Hello everyone, welcome to another episode of Easy Endo with Jay. In today's video, I'm going to be sharing a few clinical tips on how you can manage C-shaped canals in mandibular second molars. Why do we need to know about C-shaped canals? Because prevalent in Southeast Asian population, seen in mandibular second molars, especially in the Chinese population. So what makes it very difficult for a practitioner to manage a C-shaped canal in a mandibular second molar? It is the complex anatomy of these teeth that makes it difficult. If you watch closely, they have 1, 2 or 3 canals just like other molars, but these canals are connected with an isthmus in most situations. So this isthmus is a very thin ribbon-shaped canal or connection with pulp tissue. So the idea is to remove and clean this area which is inaccessible with your regular rotary and hand files. Next, coming to the steps in treatment of C-shaped canals, deroofing with ultrasonics are very important. You need to do them under magnification. For me, it's a microscope. If you don't have a microscope, then you probably can use your loupes with illumination. Next, shaping canals. Shaping canals, I told you, you have 1, 2, 3 canals, and you can use your rotary files to shape them. The next point is very important, is the irrigation protocol and activation of these irrigants. Activation of irrigant is very important because I told you pulp tissue is there in these apical isthmuses and deltas and ramifications. So files cannot enter these areas, so you need to activate your irrigants. You could use sonic or you could use ultrasonics. For me, I use my sonics. Okay, so once we activate and we disinfect the canals, next, if the tooth has an infection, could be small or large, I always prefer to go in for 2-visit procedure in case of infected root canals. I use calcium hydroxide, and it's very important that entire canals are filled with calcium hydroxide. And then comes obturation. For obturation, my preferred technique is the hydraulic condensation technique, where I use biceramic sealers with single cone GPs. You could also resort to, if you're a person who uses a resin sealer, you could probably use your resin sealer with your warm vertical compaction techniques. Next, coming to classification, Dr. Melton proposed a classification for C-shaped canals, which was later modified by Dr. Fan Bing. As you can see, this is the cross-sectional view you have from C1 to C4. So individual canals, multiple canals, they're all connected. Sometimes they are not connected. So this is how C-shaped canals look when at the orifice level. Next, looking at the tooth, this is how they appear clinically on access opening. You can see C1, C2, C3 here. We just spoke about the steps of shaping the canals. So I spoke about the importance of activating your irrigants. So let me show how I use the endo activator. So I'm going to activate for 10 to 15 seconds per canal, as you can see. We have 3 canals connected with an isthmus. So this is a polyamide tip. The polymer tip doesn't break easily, so I agitate my sodium hypochlorite. I use a full strength sodium hypochlorite, agitate it into the canal. The picture there shows the cleanliness of the canal after my irrigation and disinfection, and once I've dried the canals. There is also another sonic device I like to use, that is the Eddy tips by VDW. Well, this tip is a polyamide tip. It is used with an air scaler. As you can see, this is also activated with my sodium hypochlorite in the canal. Again, the step is the same. You need to activate for 10 to 15 seconds per canal and keep repeating it. Maybe the cycles you could repeat about 3 to 4 times. Even more, no harm. Usually go about 1 millimeter short of the apex. Now looking at the teeth, this is a case which I have performed. So you can see a pre-operative x-ray, and second is a calcium hydroxide dressing, and then you have a post-operative. I did speak about the importance of intracanal medication. As you can see, mild infections I medicate for 1 to 2 weeks. Large infections I could go up to 4, maybe even 6 weeks, and I may repeat if the size of the lesion is really large. And you can see this tooth when we go in to see what type of classification, the radiographic classification, it falls under type B. And for cross-sectional classification, it falls under C3. As you can see, 3 canals there, clearly visible in the post-operative radiograph. This is another case which I've done. Let me share my irrigation regime here. I use a full strength sodium hypochlorite, activate them with my ultrasonics, my sonic tips, and then I go in for saline and then go for my 17% EDTA activation. Look at the size of the lesion. There is a very clear evidence of periapical healing in just 5 months post-operative. So you can see the calcium hydroxide dressing. They look like obturated canals. I like to coat the entire canal with calcium hydroxide. It has always worked for me. In this particular case, I medicated for 3 weeks. And let us look at the classification here. This case or this particular tooth falls under radiographic classification type C. And for the cross-sectional, it goes under type C2. Well, thank you for watching my video, and please do subscribe to my channel.